Hello everyone, I'm Evelyn Santiago, the Executive Director of ARNEC. I am pleased to welcome you to ARNEC's webinar series on young children amidst COVID-19. This webinar series aims to provide a platform for the regional ECD community to discuss how this pandemic is affecting young children and their families. In the process, we hope that countries and organizations are able to learn from each other's approaches, solutions, and innovations so that together we are able to build a stronger response to this crisis from an ECD perspective. Today's webinar, entitled Caring for the Caregivers, Practical Experiences and Resources for Parents and Caregivers of Young Children, will be moderated by Ms. Margaret Sims. Margaret is a member of the ARNEC Steering Committee and an honorary professor at Macquarie University in Australia, after retiring recently from the University of New England as a professor of early childhood development. She worked for many years in early intervention and family support in New Zealand before moving into the university sector. Her research interests focus around quality community-based services for young children and their families. Thank you, Margaret, for agreeing to moderate this webinar, and over to you.
Thank you, Evelyn, and welcome to everybody. I hope that you will find this webinar most useful for the work that you're doing. Before we get going, I'd like to just set up some of the discussion rules, and so if we could have that on the screen, thank you. So we need to note that the webinar will be recorded, and the recording and the presentation slides will be available online on ARNEC's website after the session is finished. If throughout the session, if you have questions you'd like to ask, if you can use the question and answer function in Zoom, if you look on the bottom of your screen, you'll see a number of things, one of which is participants, and next to it is Q&A, and then chats next to that. So if you click on the Q&A button, and we'll be able to keep track of your questions as presenters are talking, and then we can come back to them at the end of the presentation. It would be really useful if you would be, well, if you're interested, to join ARNEC so that you can get the information on the next series of webinars that we've got coming up. It's free, and the link there is on the screen for you if you're interested. Next slide, please, Evelyn.
Sure.
Okay, so the first speaker to whom I want to introduce you is Pablo, and Pablo is the Early Childhood Development Regional Advisor for UNICEF's East Asia and Pacific Regional Office. And Pablo's role in this webinar is to give us perspectives on the situations of young children and their families in the Asia Pacific region, with emphasis on creating a system of care and the role of responsible caregiving under COVID-19. And we'll introduce the other panelists as we get closer to their presentation. So if I can ask Pablo to take over, that will be great. Thank you.
Great, thank you all. Can you hear me?
Yes.
Whilst Andrea uploads the slide presentation, I want to thank you, Margaret. I want to thank Evelyn and the entire ARNEC team, particularly Andrea and Joel, for helping put this together, as well as the panelists, the time to organize for this piece. And I really want to thank all of the participants, and I really would encourage you to ask some questions or put any observations into the chat box, because all of you are experts in the field, and the more we can learn from you will only strengthen our response to the children in our. I wanted to frame the context with a couple of different things so that you know that UNICEF, along with government, had to come up with a response plan to COVID. And there are 5 different areas. The first 3, I think most of you are well familiar with. They're around risk communication. So all of the messages you've heard around hand washing, social distancing, stay at home, that has been in coordination with the government. The second piece is around supplies, making sure we have these PPEs, the masks, hand sterilizer, and these sort of things. The third one is around making sure that the healthcare system has been strengthened so that our first responders know specifically about the COVID response and how to respond to that. The fourth one is the one that really hones in on us around continuous education, child protection, and early childhood. One of the new results out of a study that came out last week from the UK was when asked about being your homeschooling lead teacher at home, 47% of middle-class parents felt like they were confident to be the homeschooler. For the working class in the UK, 37% felt that they were confident. In other words, those key, our first-line teachers, our parents and caregivers, are really lacking the confidence to serve as the primary responder to children's learning and development. The second piece is I've learned with UNICEF and before that with Save the Children, many of our first responders in our agencies have not really been trained in formal child development. They're specialists in nutrition, specialists in child protection, specialists in a number of excellent disciplines, but in terms of child development, few know the difference between a 6 weeks old, a 6-month-old, and a 6-year-old. What are the needs of those child and how to respond to that? So building that strength and capacity building internally will be critical. The second and last piece I just wanted to say before I transition into the actual slides is, even in January, as public health decisions were being made about closing down, putting in schools, closing down restaurants, social gatherings, immediately we knew this was going to have a direct impact on children and on their families. And yet, sometimes we feel like sometimes the public health officials hadn't really prepared for that. So we had to quickly scramble and be able to prepare a position for this. What you're going to hear is some of the data that we try to present and continue to present internally within UNICEF as well as with our governments, and hopefully you can use these resources as well within your own organizations. So one of the first, what I'm going to focus on really briefly is around some of the factors, the behavioral signs that many of our frontline providers and many times our parents are less familiar with. And that how do you know that a child necessarily is undergoing some stress? As many of our younger children cannot communicate, they don't have the words to communicate how they're feeling. Here are some of the signs that we try to share internally. Many of our younger children might be very clingy, unusually clingy for primary caregivers. As many of you may know, many of the children may regress developmentally. This means perhaps a 3-year-old has been able to sleep through the night without wetting the bed. And then all of a sudden the child starts to wet the bed. Or a child that's been able to walk no longer can begin to do some of those milestones. This sets up a relationship whereby parents become frustrated and angry with the child because they think the child is trying to do something towards them. It's misunderstanding, but a regression during this sequence, during a stressful event, is actually quite normal. Some children may become more aggressive, some become more withdrawn, and some may have sleep problems or even nightmares. Slide. Again, additional signs of which we want to make sure that our caregivers are particularly sensitive to is these young children may have excessive crying. They may even have a flat affect, become more withdrawn. Some may demand more attention and may, as I mentioned earlier, be clingy or seek proximity to the caregiver when the caregiver may not want that child nearby. Slide. So then we look at our primary caregivers who are under extraordinary stress. As all of us know, many of our low-income and vulnerable families have been particularly hit as they are now unemployed or underemployed, so economic stress is manifested. What does that mean for them as their caregivers? Many caregivers will tend to be less sensitive to their children's behavior cues. They may not be as responsive to their child's expression. They may be frustrated, as I mentioned earlier, or irritated by the child's increasing demands and by their regression in some of their developmental milestones. They may be less emotionally available to the young child, and many of them, caregivers, may be feeling powerless, and especially about the safety of their child in face of this COVID. Slide. So children may not know how to assess the physical safety. Like they may run across a street, as many of us have experienced, without knowing that this could put them in harm. But they do know how to read their caregivers' psychological cues. They know when the parent is expressing stress or anxiety. They can pick up. They're very attuned to that. They're very sensitive to and respond to the emotional state of their primary caregivers. They also believe that adults can control things and keep them safe. And it's important for us to retain that and work with that understanding. Slide, please. So in this caregiver baby attunement, we need to promote physical, social, and emotional outcomes for the healthy child. The caregiver baby attunement also includes skin-to-skin contact of babies. Some of the interventions, such as baby massage, can support early sensitive parent-child interactions. The nurturing touch helps promote respectful communications between caregivers and the child, and massage therapy between father and child have enhanced these types of interaction. Slide, please. I wanted to spend, I think the next one is coming in on the Touch Institute. I wanted to spend a little bit of time around the importance of touch, tactile communication, as we've been emphasizing social distancing, keeping 2 meters apart. The critical, still importance to humanity and to our young children, the importance of touch. And here are just a couple of slides of which we have found from an institution that's called the Touch Institute. You can Google it, out of the University of Miami in Florida. Touch actually facilitates weight gain in preterm infants. It improves sleep patterns. It mitigates exposure to maternal depressive symptoms. So it helps not only the child, but it can help those parents that are feeling a lot of tension and stress. It reduces infant pain, reduces stress hormones, and improves immune functioning for young children and for adults. Slide, please. Again, part of the touch and baby massage it has been proven to reduce cortisol levels. And I think all of us have learned over the recent years the importance of cortisol and that hormone, how it affects, it emitted during high stress. We all know about toxic stress and the cortisol relationships. The touch enhances babies' capacity to regulate their stress levels. The touch increases melatonin levels. And this is important for the circadian rhythms. And all of us probably have studied about circadian rhythms and how this is critical for our sleep patterns. Sometimes we sleep, but we don't go into the deep sleep, which is really important for building and repairing during a course of a day. So making sure we get all the way to the deeper sleep. And it is also key in increasing secretion of insulin and gastrin, which are related to food absorption. So as we reach out to our nutrition colleagues, realizing how important that touch is, in addition to what the child ingests, the importance of food absorption, it extends and prolongs the feeding episode when you're touching the child whilst you're breastfeeding or while you're engaging with the child during a feeding sequence. Slide, please. So for caregivers, we want to make sure that the mental health and well-being of caregivers continue. So we want to continue to have caregiver support groups, making sure there's a time and space for that. Already, even in my building, I've begun to see clustering of small 1 or 2 parents with their children coming together. It's beginning time to look around at small play groups where there is, in this protracted situation, how can we begin to provide a place for caregivers to support themselves and to begin to transition back to the new normal. And then routine communications for distant parents. So for parents that may be still in the urban centers whilst their children are back in villages or separated from them, to retain some sort of ongoing routine communication between the caregiver and, or between the parent and the child. Slide, please. Recently within UNICEF, we had a conference call to identify what are the common communication channels that we are using to reach households and families. I'm sure many of you are starting to look, many of you are familiar with these, but these are just sort of the outlines of what some of our UNICEF colleagues have named. You could probably add to this list. We would welcome your contribution from conventional TV, radio, newspaper, the social media, the WhatsApp communication, at-home learning. We have an at-home learning challenge where we do one activity every day to challenge families to step up and participate in that. Slide. So in 2009, I think we began to look at the ages, stages, and phases. Keep in mind that the COVID crisis, much like many of our humanitarian crises, there's a phase. There's the acute emergency, there's the protracted phase, and then there's what we're going to be calling the new normal. And in those, there are certain core messages that we were communicating. When we first heard about COVID, we were all around wash hands, social distancing, stay home, wear your mask, close the schools, get at home and start doing some at-home learning activities. Let's acknowledge the constraints that you're going to be at home. Very quick response to the acute emergency. We're now around 2 months, 3 months of time, and we need to begin to look at the extended emergency. It's not necessarily the acute emergency, but looking at the protracted emergency. Let's look at the channels. Let's do the landscaping of channels that we can reach families, and that was presented in the previous slide. Let's look at the channels, how we can reach frontline workers that interface with families. And we can begin to look at mini play groups, and then look at, as we had mentioned, what is parents' readiness and confidence to respond to the children's needs as they stay longer. Lastly, some of these, in the last slide, this new normal, COVID has acted, quite frankly, from my perspective, as an accelerator to our nurturing care framework. Creating a national coordination mechanism, coming up with some sort of communication plan for families. We're calling these sort of a family prescription for COVID. Developing remote capacity building for frontline workers. This is all part of the nurturing care framework, and COVID is only making it more important and more clear to our mandate to work with our governments and our community-based organizations to accelerate these sort of new approaches. So just making sure that you're not getting stuck in just the acute or protracted emergency, but we continue our longer-term vision around ECD and this new normal of development. Slide. There's only 2 more slides on my side, and then I'll transition. There are some key COVID takeaways. Be sure around physical safety, making the child feel safe from the germs, the emotional safety, that they're worried about disappointing parents or feeling embarrassed if their online learning community, that they're not doing well, making sure we're listening to their psychological safety, making sure that we're listening to their sense of identity, and looking at the intellectual safety, encouraging your child to think creatively as they solve problems. Last slide, please. So some COVID tips, and you'll hear a lot about these because each of our panelists here will go into even more depth around how to respond to parenting tips. Relax, really enjoy. I've been trying to tell all of our parents, enjoy this time together as much as it is a horrific experience, but enjoy this time to be with your family. Focus on your child's needs. And there's a lot of resources that have been listed by ARNEC on their website. I'll list a couple of sites. Throughout this presentation, you'll have a number of resources about what are the needs of a 6-month-old or a 3-year-old or a 6-year-old. Know that you're not alone. So making sure that you reach out and access those resources and reach out to your colleagues and take time to breathe. Make sure you start your day with some sort of meditation, spirituality, relax, stay calm. This is going to be around for a while. Let's begin to transition towards this new normal. I think the last slide only has a couple of links that we will share with you. Last slide, Andrea, I think. I just presented, the last one was around INEE, the Interagency Network for Education and Emergencies. And then UNICEF had already started a parenting portal, which is open externally. You know, many of us have great resources that are listed only for internal uses. This one is available. You can share with your government partners, your CBOs, etc. Thank you very much. And back to Margaret. Over.
Okay, thanks, Pablo. We'll go straight into the next presentation, and then there'll be some time for some questions and some discussion after the next presentation. Just to remind you to put your questions on the question and answer tab, which you'll see at the bottom of your screen, and I'll keep a record of those, and we'll try and address them as we go through. But what I'd like to do now is introduce our next two speakers. We have Dr. Jamie, who's a research associate at the University of Oxford, Department of Social Policy and Intervention, and a research fellow at the University of Glasgow. And along with him, we have Ramaya, who is an associate professor of family and child ecology at the Department of Human Development and Family Studies at the University Putra, Malaysia. So welcome, Jamie and Ramaya, and I'll hand over to you.
Thank you very much, Margaret, and thank you, Pablo, for a great overview, especially on the biobehavioral and developmental impacts of stress, and in particular COVID-19, and how that impacts the relationship between parents, caregivers, and their children. So I'm going to be talking with Dr. Ramaya about an interagency initiative that we've been doing globally, but with a lot of focus in the East Asia and Pacific region, on responding to the child protection and parenting concerns with COVID-19. So we know that with early childhood development in the global South, that research has shown that about 250 million, or 43% of children under the age of 5 are already, before COVID-19, at risk at not achieving their developmental potential. And that 1 billion children, which is 50% of the world's population of children, experience some form of violence globally each year. We also know that early child development and violence against children are linked by similar risk factors, including poverty, poor health and nutrition, stunting, psychological deprivation, intimate partner violence, and that there are long-term effects on both the child and into adulthood on health, learning behaviors, and poor economic outcomes, even on a country level. Fortunately, we know also that the role of parenting can have a positive and a negative impact on childhood and later adult outcomes. So evidence for over 50 years of research on parenting and parenting interventions shows that positive, consistent parenting will predict more likely to have better child and parental mental health, school readiness, and partner relationships. But conversely, harsh and inconsistent parenting predicts poor child development, behavior problems, juvenile delinquency, crime, drug use, family violence, school failure, and poor health. And that this cost of poor parenting is very high. In fact, there's multiple studies that have found that it's up to even $500 billion in the United States. Research has also shown that parenting interventions can be effective at reducing both violence against children and improving child outcomes. And most of these interventions are based on similar content and scientific principles, including focusing on improving child development and health, increasing nurturing relationships and attachment between parents, caregivers, and their children, increasing positive parenting behaviors, increasing play, communication, praising of positive behaviors to happen more often, and educational involvement. And also that parenting interventions can be effective in improving child behavior management skills for parents and reducing violent discipline and negative child behavior. And lastly, which is encouraging and related to the COVID-19 context, that parenting interventions can also be effective at reducing parent stress and depression. We've also seen an increase of research on parenting interventions in the global South, including over 90 rigorous studies in emerging economies over the last 20 years, 30 years. And we also find encouraging signs that transported and grown parenting programs are equally effective as long as they're based in core principles, and that poor families, single mother families, migrant and ethnic minority families are likely to benefit as much as average families when we look at the meta-analysis of different studies on parenting interventions. And lastly, that parenting programs tend to be equally effective for young and older children, which is encouraging to say that it's never too late to be able to improve your relationship between your child and your child outcomes. So that's kind of an overview of the impact, of parenting interventions before COVID-19. But now we see that there's a crisis care, especially when it comes to parents and caregivers' ability to provide support for their children and those agencies that provide support to those parents and caregivers. For instance, due to lockdown, many group-based programs are not possible anymore. We've also have over 188 countrywide school closures with 1.58 billion children estimated to be out of school, meaning that parents and caregivers are now having to provide 24/7 care to their children while also juggling difficulties with working at home or uncertainty about having and stress about not having work. And we also know that low-income families that are living in crowded communities and in tight homes with large household sizes tend to be affected most. And we've also know that from previous health emergencies that during health emergencies, there's an increased escalation of child maltreatment. Some of the increased risks of violence against children include reduced social support due to isolation, increased alcohol and substance use, increased stress, depression, and anxiety, increased intimate partner violence. For instance, we've seen the reports, even in the UK where I am, that up to 25% greater reports of intimate partner violence on the hotlines and support systems. Also in crowded and cramped living conditions, financial and food security, and increased risks of child safety online when children are now interacting more in the online world. So Parenting for Lifelong Health, which is an initiative that is the University of Oxford and University of Cape Town and other institutions is part of, has worked with the UNICEF, the CDC, World Health Organization, the Global Partnership to End Violence, and other partners to develop a set of parenting resources to help support parents who are needing some help and guidance during this difficult time in COVID-19. And these resources have been derived from rigorously tested evidence-based programs that have been tested in low and middle income countries. And then what we did was we adapted the content to fit the context of COVID-19. We had originally developed 6 topics, which I'll talk about in a second, and then 6 additional topics focusing on specific issues that parents are experiencing. And these resources were simplified so that they could be transportable across languages and contexts, and that they're also relevant for not only COVID-19 context, but beyond COVID-19. So the first original parenting resources that we developed focus really on the establishment of positive relationships between parents and children, and looking at the way that parents in trying to mirror the way that parents in normal programs would go through developing a positive relationship with their child before dealing with difficult behaviors and nonviolent discipline. So we started with one-on-one time with children, as looking at COVID-19 as an opportunity for you to spend more time with your child and to allow your child to take the lead, giving parents ideas that they could do with their babies or their young children or their adolescent children in a way that is dedicated time where they're giving their focused attention. The second resource was around keeping it positive, using positive instruction giving and also praise in order to encourage and reinforce positive behavior to happen more often. The third sheet was around making routines and keeping children safe and learning about COVID-19 related hygiene and health behaviors that are necessary, especially during this time where our schedules are really are changed and we're no longer in our normal routines. This can be a time where children really need that safe, secure scheduling in their daily life, including time for play and time for structured activities. The next one was around managing difficult behaviors, helping parents to redirect difficult behavior to negative behavior towards positive behaviors before they get too bad or get too difficult, but also to learn how to use appropriate consequences. The fifth sheet was focusing more on the parents' own ability to cope with stress and need to take care of themselves. And then the final sheet was around talking about COVID-19 with your child. And these were initially released about 3.5 weeks ago. Since then, we've also just recently, 2 days ago, released an additional 6 resources that we are now translating into multiple languages. And these include online child protection, helping children learn, parents engage their children through learning through play, addressing family harmony and the impact of intimate partner relationships in the context of parenting, helping parents cope with living in crowded households and community, a specific tip sheet that focuses on managing anger and stress, and then also family budgeting and financial stress. And we're also developing specific content for early childhood and adolescence. So the reach and response of these parenting resources has been quite remarkable and something that we did not expect initially. So the resources are freely available on the UNICEF, World Health Organization, Global Partnership websites and social media platforms, as well as a lot of different other partners. We've estimated that 43 million children have been reached in 178 countries. We've translated the tip sheets into 75 languages, mostly due to the support of volunteers. Multiple governments have adopted these and have been publicizing or disseminating these resources in many different ways, including governments in the Asian Pacific region, like Cambodia, Malaysia, Thailand, Philippines, Vanuatu, and Vietnam, and Bangladesh. And also, we've even had some media coverage, including Angelina Jolie mentioning the tip sheets in Time magazine. But we've also noticed that we need to move to a next phase of our reach and response where we can adapt and scale up the resources to reach more vulnerable families, including those in rural areas, those who do not have internet connectivity, homeless families, people with disabilities, and refugee and migrant communities. And so now I'm going to hand it over to my colleague, Dr. Rumaya from University Putra Malaysia, who will talk about the context in Malaysia.
Okay, thank you, Jamie. Hi, everyone. And I'm just reporting on how we disseminate and contextualize the parenting resources in Malaysia. So far, we are considered relatively low in terms of COVID-19 cases, slightly under 5,500, and with death of 92 cases. We are still undergoing the MCO, started from March 18, which includes all those things that you cannot move around easily. And schools are closed, and we have heard what Pablo was saying just now, and parents in Indonesia also facing all those challenges, both to those who can access to internet as well as those who don't. Most parents would say that they are not ready or even equipped with the skills and knowledge to tutor their own children. And definitely it's not easy to do in-person child protection for those who are needing. Next, please. In terms of dissemination, we have been working closely with UNICEF, definitely, and with my university, University Putra Malaysia, and the main ministry, Ministry of Women, Family and Community Development, particularly with the National Population and Family Development Board, who has been training many parents in terms of parenting skill. And the strategic partners comprises NGOs and business partners in terms of distributing materials to reach as many parents as possible. And in the pipeline, there's also plan to support child protection case workers in terms of management using online materials and or by phone. Next, please, Jamie. So, this is the dissemination strategy ranging from low, for those parents who have low internet access, to the highest continuum. We try with leaflets and pamphlets, or all those hard copy versions possible for those that we know won't get access to the internet, that can be left with the community centers or packed together with the food basket and whatnot. And we are trying also to get access with radio and TV stations to give us some slots be it video or audio, for these resources. And the one in yellow are all for those work under progress for messages and adaptive testing as well. And what is now being highly used for dissemination is for those high internet access target group, where we have been using all social media messages with all those medium possible, Telegram, WhatsApp, Facebook, Twitter and whatnot, and reaching out to as many groups possible to use them as partners to disseminate the messages. So we have tried with parent teachers associations at schools, and we really hope the Ministry of Education also will help us in this, and as well as strategic partners of the ministry. So basically, we are trying all out for this, hoping that we'll get as many, we can reach out as many parents as possible. And we also note that there'll be very high risk families will be needing helps and resources, and we are trying to guide case workers and social workers on how to use online materials and phone to manage their cases. The next is my last slide, Jamie. All in all, we know that time is essence, but principles of these parenting resources are universal, where the context can be a little bit needed to be modified, but everything is universal, is friendly, and basic focus is on the relationship between parents and children. And we need to be the rapid development and dissemination of resources were required. We strongly believe that these materials can only work when they are evidence-based, based on research. And then we know there's limited impact because of the touch. The touch is being light when it's considered using online materials. But one thing that is noteworthy, that we have to note, that we need to have evidence also to see whether these resources are making an impact on the parents that we reach out. So there's a need to build in monitoring and evaluation of reach and impact, but we are also aware that there's funding issues, which is very critical. Okay, with that, I hand it over to Margaret. Thank you.
Thank you both. I'd like to start the question and answer session with a summary of several questions that people have asked on the question and answer forum, and directing it at you, Jamie. People are particularly interested in dealing in the child protection arena, and I know we're going to have a webinar on that particular topic coming up, but maybe you could just give some idea of the ways of working with families where children are either victims or witnessing family violence in this particular context, where people are socially isolated and being required to stay in their family groupings.
And thank you very much, Margaret. So when it comes to children who are currently experiencing violence in the home, the different policies or protocols or approaches will generally differ by country context. Although on a global level, even during COVID-19, the World Health Organization has guidance that children should be removed from violent situations when necessary and when possible. What we are trying to do, as Dr. Ramaya had mentioned in our presentation, is to help child protection officers and people who are managing child line services in some countries to have an ability to be able to conduct their case management online and via phone, to be able to make the assessments and support parents where it's possible, and then support children where it's necessary. So this is a definite concern, but it is something that I still think is possible. And when it comes to having to actually go directly to homes, I think that in some contexts, like in the Philippines, this is still possible to happen when children need direct intervention. Thank you.
Okay, thanks, Jamie. We have one question that is around street children, and I haven't got permission from the person who asked the question to ask if that question live, so I'll ask it on that person's behalf. And I guess this question goes to any of the panelists who feel appropriate to answer. So how would we work in this context with street children? Don't all jump in and answer at once.
It's a really difficult question. So you can hear that the silence means that this is something that maybe we need to spend more time thinking about. With especially making, street children are the most vulnerable children living in very difficult circumstances, and so they often some street children are living in families, and then in that sense that it's really important that we support the social services in different countries to be able to reach out to them and make sure that they are safe and getting shelter when possible. But those who aren't, then there's a separate issue with that. I wonder if Pablo, UNICEF has any guidances around that.
Yeah, I'm sure if I reached out to Rachel, I would get a very lengthy response. From a developmental pieces, I would want to make sure that these children, there should be a place. What we can do ahead of time, and even now, is to establish a place or a specific time that is a safe place, and all of these children should know that they have access to this. It's free, it's non-judgmental, and it provides a safe, clean, and secure environment for those children. That needs to be put into place ASAP, so straight away, working with our governments to make sure that they have these places in place. And that could be something as easy as a warm line or some way to reach out to them. There could be a physical place, it could be a contact place, but there needs to be some place and ideally someone in each community that's identified that is there to receive and make sure that they have a safe and secure option during these horrific conditions. But I can reach out to my colleague Rachel, who is the regional advisor for child protection. I'm sure she has more in-depth response. Over.
Okay. There are a number of people who have asked questions around reaching people in remote, rural areas, people who are really difficult to reach. And I think we will get to that as we move through the presentations. And if we don't, I'll come back to it at the end. But I think we should now move on to the next presentation. And I'd like to introduce to you Fitriana. And Fitriana is a child development specialist at Child Fund International in Indonesia. And over to you, Fitriana, for your presentation.
Yes, thank you, Margaret. Good afternoon, everyone. And I'm sure who attending here is one of your role is a caregiver, parents, and any other important role. So I just want to say you are a special and your willingness to learn together on this webinar. So I'm start with the Indonesian context about the issue on caregiver related to the COVID. There are, like Pablo just mentioned, general issues about the worry about uncertain situation. The many questions from the children is like, when is it end? When I will go back to the school, meet my teacher and everything? Why I can go to meet my friend? So these things, simple question, but difficult to answer. Some is less of family earning, additional burden or multitasking, hoping for a normal response in abnormal situation. This is something that we have to consider for our stress release. The situation is abnormal, so don't hoping too much for to be a normal. That will be reduce our stressful condition. And the specific things that related to the early childhood children is sometimes in extreme case, I found children is more attached to their teacher than to their parents. So they are, when a week doesn't go to the school, they start crying, I want to meet my teacher, and they don't want to do the task if not the teacher calling her to do something. So this is something that we need to consider. Then how now parents take all the responsible of learning. Then next, this is about the parenting guidance from WHO. I will not talk much about this because it's already shared by Jamie. I just want to show that we as Child Fund is already contextualize this guidance to be inserted in our routine parenting program. In Child Fund Indonesia parenting program, since 3 years ago, almost 4 years, we have a two main program, which is responsive parenting, that for a parent and caregiver for early childhood children, and positive parenting for school-age children. Why we have to make difference? Because each of the age group has its own characteristics and it's that require of different parenting style. So that's the main reason why there's a two parenting program within the same targeted parents. So this is three guidance supporting the guidance from WHO and UNICEF that we already show and share to our parents in the field. Things about the keep normal routine activities. Sometimes with the situation that children didn't go to the school, they think that they can wake up late, they don't need to go to the shower and everything. It makes the children is difficult to manage. Well, actually, the difference is only the location. The learning, the routine activity should be is the same as when they go to the school. And then the second is about the caregiver part, how we change the mindset that education or learning and care is one unit. So this will be make more easier for us in our mindset that as to decrease the multitasking, another burden, because we feel it's not actually not my task, this is the teacher task. But if you think this is one unit, this is an opportunity for us to more close to the children, then it will be easier for the parents to cope with this situation. And also the third one is about how we focus on caregiver mental health and well-being. Why? Because we can provide good child rearing in stress or while feeling depressed on the situation and everything, or even feeling stressed with the action of our children. So this is, I'm just sharing about what the parenting program in Indonesia context that we are implemented in 15 local partner in around 8 province, almost 200 villages with the parenting program. There's a normal situation, I won't talk much, you can read in my presentation, but in the current situation, we need to adjust. So for the area that already have active COVID case, such as Jakarta, Java, is all red situation. We stop the routine meeting and changing the mechanism to Facebook, WhatsApp group, call and video at evening time, 30 minutes to check how the parent condition with their children. Then capacity building facilitator is through Zoom meeting by monthly. And then for the remote village that not yet found active COVID case, where the internet is also a challenge, and where it's like if you go over to Sumba, there's like a pattern, one home, one house is one village. So they are very depend on the routine activities. So the parenting group that already set up with routine meeting per 2 weeks, it's become the facility for us, for a child fund, to share about the COVID situation. Sure, so they still come in the group, but the session or the protocol is using the protocol of respond COVID, sit in distance, wear mask, hand wash when entering in the venue, and shake hand. This is the standard content of parenting class. If you see in the black, the left side is about the normal situation. There's general content for responsive and positive parenting, and other the specific of responsive and positive parenting. While for this COVID situation, we are focused on the information about COVID, sharing and support and facing daily parenting challenge, parenting group as the media for sharing COVID information, IEC distribution, parenting tips, and active guidance of parents and children for all age group. If you see in the general concept, general content, there is positive discipline. This is actually the thing that I think based on the implementation of 4 years become very critical during this COVID situation and how we respond. Why? Because we, based on our group, parenting group that already established for almost 4 years, regular parenting program does support the caregiver psychosocial status during COVID outbreaks. Why? Because practicing positive discipline in daily care decrease the tension of caregiver and the children. The example things is sometimes as the parents, we are very easy to say, don't do this, don't mess the room, don't be naughty and everything. While actually, and it's aligned also with the guidance of WS, how we said directly what we want to children do. Rather than said, don't mess your room, let's clean your room and everything said directly. We want to say what we want children to do, not the opposite things. And then the parenting group, because they are already routine meeting, they are become a bond and become have directly support each other about this challenging situation. Sharing the stressful, sharing the about COVID, and support strengthen each other also about disease will pass. We will have to keep positive thinking and mind and everything. And then see, this is some things that I learned is become the unique of Child Fund International Indonesia is how our parenting program is entitled or embedded with the session of mental health skill. There are some skills that we teach them to run, start from managing negative thoughts, negative feelings, self-respect, take a good decision, seek support, even simple relaxation practice. So this is also aligned with the guidance from WHO, how we take 1 minute pause when we are already in very high tension to the children. It's okay for not respond to them a while, to control ourselves first, rather than we scream to the children, yelling to the children. It's better to stop, relaxing, feeling our breath, and then after 1 moment, 1 minute is enough, we discuss again with our children. This is the testimony of the caregiver. The first thing, if you can see, is about the sharing from the tutors of our ECD teachers that facing two different type of parent who join routine in parenting class and the parent that never join. Parent who join routine the parenting class, it's very easier managing their young children, because in our parenting class they are have a practical session to stimulate the children on cognitive language. Even they can do a storytelling to their children. While the parents that never access a parenting program always call the teacher and then give the phone to the children and ask the teacher to set something good to about the task and everything, because the children doesn't follow from the parents' request. This is the things, and then this is sharing about the how the mental health is working up to this. Like in this, I try to because this is really a testimony of one the parents. I was feeling so tense. I was worried about my family. But then I practice managing negative thoughts and dominant feelings. I said to myself, this will be past, and practical simple relaxation when anxiety comes. I will be okay. My children face this difficult time and cannot meet their teacher, their parents, and their friends. I have to support my children the best I can. This is from the Central Java. And the other thing that's interesting is the way how this situation of 24 hours with children is really make the parents practicing what they learn from the session of parenting. The last session that they learn, example, is about the parenting 4.0. It's how about the we coping as a parent, responding children that cannot divided from the gadget. So before I got parenting 4.0, I always complain when my children spend time on their gadgets. But now I realize that I should take a position on my children's side and be friends with the gadget as well. So this is something when how the challenging situation can be very positive for us as the parents, how we make this as the opportunity to be close to our children. The last slide is I want to thanks to you all to be here. And I want to remind you that you are always a special person for your kids too. Never doubt about it. Second, caring our mental well-being is a process. It's not one night process. There is no instant ways of change. Love yourself first before able to provide meaningful caring for your kids. Then, if you found something useful from this webinar, start act, doing something. Change won't happen without first step. Fourth one, the last, you are not alone facing this. If you need support, help, just asking, just seek help. Everyone always needs social support. Seeking help doesn't mean that you are weak. It just means that you are human, the same like others. Only that from me, Margaret. I'm back to you. Thank you.
Okay, thank you for that, Fitriana. And we'll go straight into the last presentation, and then we can wind up with some questions, and I'll try and cover some of the questions that have come through on the question and answer session. So I would like to introduce you now to Aparita, who is an early childhood development specialist at UNICEF in India. Aparita, you're there and you're ready to go? Yes, you are. Welcome.
Thank you, Margaret, and good afternoon, colleagues. Thank you for joining this webinar. I would like to thank my fellow panelists for making my work a little easier, for presenting before me and laying down the foundation for my presentation. So, yeah, so the context, we have talked about COVID-19 and the context that we are in. It has changed our lives. It has ended lives of families, children. There's a lot of uncertainty around this. We don't know when it's going to get over, when are we going back to normalcy. And there's fear. There's fear amongst adults, children, everyone. And if we talk about children, we need to provide, we need to provide for them. We have to ensure that they're cared for, they're protected, they're well, and yes, and also their survival. To talk about the Indian context, the COVID-19 cases are on a high. As of yesterday, we had 20,000 cases, and by midday today, we have almost 1,500 more cases. The concentration is more in the urban and the semi-urban areas. Our country has been in lockdown since 25th of March, and the lockdown has been extended to the 3rd of May. All services except the essential ones are being suspended. The preschools and the schools have been closed before the lockdown, so mid-March, the schools and the preschools were closed. After the 3rd, the plan is that the state governments are planning a scattered lifting of the lockdown. The districts across the country have been color coded as red, orange, and green. Red as the hotspots, orange as with few cases, and green as with no cases. So when we talk about the context and the feeling in this context, parents and children are home, so it should be a good thing. But emotionally, people are not feeling very good about it. So this is an evidence from the urban population, and more than 40% of people, mostly adults, are not feeling okay. They're emotionally distressed. They're not at peace. They feel scared. They're anxious. They're not happy with the current situation they're in. But can we look at the situation as an opportunity? Can we think that we can, this provides an opportunity for us to to bond together as parents to children, as we are all confined in the home. The preschools and schools are closed due to the lockdown. There's restricted movement. Children cannot go out to play, and so our young boys and girls are confined to home. Can we, parents and children, come together, spend more time together, and bond? And can we think of this as more play and learning? Can play parents take this opportunity and become the so-called the teacher, where and provide the learning and the play opportunities to children? This is a way to probably continue learning for the young kids, as well as play is a test person for the for parents as well, the adults as well. So like Pablo talked about the parenting resources or the parenting portal that UNICEF has, we are focusing on the three important pieces, which is preventive care, psychosocial well-being of the children, as well as the caregivers, and continued learning. Um, so we need to reach out to the parents. Parents are the ones where the children are now that the services have been closed in India for a very long time, more than a month now, and only essential services are on the ground, running on the ground. Which so our usual suspect, the community worker, who is the community health nutrition worker in India, called the Anganwadi worker or the Asha. She is they are involved in different kind of work. Which is depending on the state government they come under. So they are into different kind of work, and she is not able to reach out to the parents with this kind of a message, because there are priorities that come before maybe parenting and reaching out to the parents with the caregiving messages. They're more concentrating their efforts around THR, or the take home ration delivery, or contact tracing, or finding about more about other cases, or giving community more information around COVID-19 and prevention around COVID-19. So uh, so they I so and 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 then the second thing that we have is the internet access is not the same across the country. So we have areas or pockets where internet, or the smartphones and this technology has penetrated, but there are other pockets in the country where we do not see that. So we need to think out of the box. We need to look at more innovative methods to reach out to parents, maybe phone calls, maybe IVRs, along with continuing to work with the social media, the WhatsApp and the apps and the other things. Now that the community worker has many things at her hand which she's dealing with, we also need to maybe expand our workforce who understand parenting programs, or who understand what it means to be a to take care of children. In this piece, COVID Academy is one of the forums that has been formed to reach out to more organizations as well as volunteers, on the ground volunteers with messaging around parenting. So what is COVID Academy? It's an innovative platform that has been developed by multi-agency collaborators, and it has five most important agencies coming together. So the National Disaster Management Authority, which is the apex body of Government of India, mandated to lay down policies for disaster management. Sphere India, which is a national coalition of humanitarian agencies in India with a vast network of organizations working in different aspects, as well as volunteers. UNICEF and WHO as technical partners, and HCL Foundation is providing the IT platform for this academy. This is an online academy, a platform where capacity building of frontline volunteers and outreach workers can be done through various technical sessions, and so that they're more prepared to respond to COVID-19. Uh, so till date, there have been the COVID Academy was launched around about 2 weeks back, and a number of sessions have been done on different topics. The list of sessions is here. It talks about basics of COVID, it's stigma around COVID, maintaining healthy eating and lifestyle, infection, disability inclusion, welfare of animals, child protection, and psychosocial support, supporting food security and nutrition during COVID-19. And there was also one session where we also talked about the responsive parenting during COVID-19 through this academy. We launched the first course. The idea is to have repetitive courses, repetitive sessions, and with different volunteers and organizations. The first, we have just done one course till now, where we had around 940 volunteers joining from different parts of the country, where they were individual volunteers, they were part of bigger groups and organizations. The focus of this session was to orient these people who may have not worked in parenting programs earlier, to orient them on responsive parenting. What are the tips and the messages that they can take to parents? What are the and also hands-on activities for children, which they can discuss with parents and tell them what they can do. And we also provided them with a lot of material or resources where they can go back and read, and as well as videos which they could see and do different activities and talk to parents. There was a lot of discussion around how to reach to parents. How do you reach and talk about parenting to people who are probably not educated, coming from tribal areas, or no internet? So how do you reach out to those people? So there was this discussion around it, and we found answers within, while discussing things. The idea is that these volunteers are going to reach out to parents through their organization or individually. The plan is also to place these volunteers within the local government authorities, so that there is this so that whatever response work is happening can include the messaging around responsive parenting. And there's a hand holding mechanism and the feedback mechanism in place, where with community focal points. What messages did we talk about? Yes, we did focus a lot on the global parenting resources, which are the 6 key tips that we have all talked about in our previous presentations. And I'll end my presentation with this one drawing by one of the kids, that how they want to spend their time during the lockdown. Thank you so much. Back.
Right, thank you, Aparita.
Back to Margaret. Thank you so much.
Right. I think that there have been a number of questions around reaching families in remote areas, families with limited internet. I think perhaps our panelists have touched on that, but if there are particular issues you want me to follow up with the panelists, please put a question in the Q&A session right now, and I'll keep an eye on that. But while you have a chance to think about that, what I want to do is follow up a couple of themes that have come out of those questions, which are particularly related to working with parents, parents perhaps who are depressed, parents who might have mental health issues. If any of the panelists wanting or able to have a little talk about working with that particular group of parents who would find it very difficult to have the emotional energy and resources to engage in parenting programs.
If I can just jump in, this is Pablo. Having the expertise with caregivers with mental challenges is a unique kettle of fish. There's a unique challenge to the literature. I can tell you there is an excellent site called SAMHSA that I'm familiar with, Substance Abuse and Mental Health Association, SAMHA, which has excellent resources. So as even an ECD expert like myself, one can't be an expert in all of the sub-themes within the area. I would I know, but I have a pretty good idea where one can go to find some good resources. I would go to the SAMHSA website, and there would be some great leads there.
Perhaps you could put
In
that on
terms of the remote learning, okay, let me put that in the chat box. Yes, okay.
Yeah. Just so that people can get that.
Yeah. Can I
Yep.
add short of the new
Yes,
tablet?
go ahead.
Yeah. It's yes, it's true. It's challenging, but it's not that impossible things. The things that when we facing parents with a mental problem is we have to realize this is not one shot treatment. This is need time. They have to be friendly with us to able for us to support them. So how the structure of a routine session of the parenting can be one of the effective mechanism to support them, because when they are feeling comfort with the group, with the facilitator, it's more easier for them to talk and easier for us also to help them to coping with the problem. So that's the things that I just want to share to add Pablo explanation. Thanks, Margaret.
Okay, if
Margaret,
any
may I
of
add
our
in the
audience have resources, do please put them on the chat so that others can see. Jamie, you want to say something?
Yeah, I think that so in the resources, the World Health Organization, UNICEF parenting resources, we've included 2 tip sheets one on anger management specifically, which is also to kind of avoid conflict in the home, but also one specifically on reducing stress. And it has simple activities that parents can do that can support, especially one that is derived from mindfulness or meditation practices called taking a pause, which we found, at least in our group-based programs prior to COVID-19 and the research, has been really an effective mechanism for helping parents not only cope with own stress and mental health issues, but also to be more responsive and less reactive to their children. In Malaysia, what we are doing is helping develop guidances for mental health workers on how to also provide online and phone-based support to those who are having mental health issues that need extra support so that they can access that. So that's another aspect that is related to parent mental health that we hope to be able to have rolled out in the next couple of weeks in Malaysia. Over.
Okay, thank you. Before we wind up, I'd just like to throw it over to our audience. And is there any member of the audience who have a really burning question that you think we haven't answered, or that you don't know where to go to find the answer? I'll give you a second to ask a question if you want to. No? Okay. All right. Well, look, thank you very much to all our panelists for coming on board, and for our amazing audience, all 214 of you. That's pretty impressive. And yeah, watch out for the following webinars coming in from ARNEC. And good night from me, good morning and good afternoon from some others. And I'll hand back to you, Evelyn.
Thank you, Margaret, and thank you to all our presenters and to our attendees. We have reached really, like, at one point it was about 227 participants. You know, some needed to go, but as Margaret said, we will be providing all the recording and all the presentations later on. So please stay tuned. Just 3 requests from our end before we finally close the webinar. So first is that we actually have, this is actually a series of webinar. So if you can please stay tuned for the announcement for the, succeeding ones. And we'll have it, announced at least a week before the actual webinar date. The third webinar would be focusing on understanding how young children cope with stress, fear, and anxiety during crises such as COVID-19. And it's quite related to this topic that we have now, but it will really focus on the social emotional learning of young children and how parents can actually support them. After each webinar, we actually give or send an evaluation form. So I would like to request all our attendees if you can respond to the webinar evaluation form. It's gonna be very short, but it will really help us in terms of framing the next, the succeeding webinars. Third request from our end, we just launched a survey on the impact of COVID-19 on young children and on ECD as a whole. And this is framed within the elements of the nurturing care framework. Your views are very important as ECD champions and advocates. So please respond to the survey and share with your colleagues and network. We promise to share the results of this survey so that we can all make use of it in our advocacies at the national, regional, and even global levels. Again, thank you for joining this webinar and hope to see you, to have you all again in the upcoming webinars. Thank you, Margaret, and thank you to all our presenters. Thank you. Stay safe, everyone.